today about pineal tumor. Learning objectives: most common pineal abnormality is pineal cyst. Most common pineal neoplasm is germ cell tumor. The most common of them is germinoma, which is homogeneous, engulf pineal calcification. The next most common type is teratoma, which is heterogeneous with lipid. Pineocytoma and Pineoblastoma, the pineal parenchymal tumor, may respective diffusion by the image. They cause symptoms that are called paranoid syndrome, which included inability to look upward, double vision, and nystagmus. The tumor causes compression with the cerebral aqueduct of Sylvius and causes hydrocephalus, and the growth vector push masses in posterior fossa. Other lesions like vein of Galen malformation, which is so fluid, Meningioma, which is attached to the dura, glioma and lymphoma, which contain fat. Differential diagnosis: pineal region mass. Germ cell tumor account for 60% of this. There is pineal germinoma, most common type, account for 15 cases of all tumor. Pineal teratoma and non-germinoma. Pineal parenchymal tumor account for 15% of cases. Other lesions like Astrocytoma, pineal metastasis, pineal cyst, Meningioma, lipoma, vein of Galen malformation. Pineal gland is pine cone shaped midline structure located in epithalamus region near the center of the brain, between the two hemispheres, in a group where the two halves of thalamus join. Main function is the secretion of melatonin, a hormone that is best known for its role in regulating circadian rhythm. Pineal melatonin suppresses gonadotrophin releasing hormones. Longer daylight decreases melatonin. Decreased melatonin lead to an increase in gonadotrophin releasing hormone. Increases this hormone lead to an increase in luteinization hormone and follicular stimulation hormone. This is the sagittal T2 weighted image for the child. Show the pineal normal location of pineal gland, which is inferior to the internal cerebral vein and vein of and inferior to the splenium of corpus callosum, posterior to the thalamus, superior to the quadrigeminal plate. The line of orientation of tentorium between the straight sinus, which is the confluence of internal cerebral vein and vein of Galen, to the anterior clinoid process of the clivus. So the pineal gland is fairly located normally above this line. There is a cerebral aqueduct of Sylvius and fourth ventricle. Normal pineal gland, this is a reddish brown, pine cone shaped structure behind the third ventricle between the two thalamus region. This is the axial CT scan of the patient showing physiological calcification of normal pineal gland. Pineal gland. Now stop.
صح معلش انت قاعد عندك مايك تحكين بيه؟
اي
صوت بيه مثل الصدى يقولون الطلاب وصوتك يعني كل شوي تصير خرخشه بالمايك.
صحيح، ليش ما تحكين دايركت بابا على
احكي مباشره الغي المايك احكي من الحاسبه مباشره.
اوكي.
ايه هسه احسن.
هسه استاذ.
ايه هسه اوكي.
Normal pineal gland diameter and sagittal section about 10 to 14 million. Pineal region masses, sign and symptom, causes paranoid syndrome, as we said previously, causes precocious puberty, loss of inhibition of gonadotrophin, hormone secretion, cause non-specific, non-localizing mood effect like headache, nausea, and vomiting. This is the chart showing that germinoma, teratomas, germinoma's most common type, followed by teratoma. This tumor can easily be differentiated by the CT and the MR. Usually primary in CNS, not metastasis, arises from germ cell rest or germ cell precursor, like pineal region, quadrigeminal, and suprasellar system. Exceptional cases, metastasis to the CNS, like testicular vein lymphatic drainage to the renal hilus, para-aortic, which is drained to the lung, which is drained to the systemic hematogenous, including CNS. Rare case of testicular seminoma have CNS metastasis. This is the basic approach to the pineal region. We're going to talk about germinoma, next teratoma, non-seminoma, and the pineal gland, differential diagnosis. Pineal gland germ cell tumor, germinoma, have a good prognosis. Up to 19% of the cases survival at 5. صوتي واضح؟
اي بابا اذا نسمع.
The next most common type, which is teratoma, up to 74% survival at 5 years, non-seminoma and the mixed type. Germinoma affected younger patients between 5 to 35 years old. They have female predilection, engulf the pineal central calcification, increase in ADC, show sometimes CSF secrete brainstem and pythalamic region. Most common location in the pineal region. By imaging is sharply circumscribed midline mass surrounded engulfed pineal gland calcification. In non-contrast CT show homogeneous hyperdense mass with enhanced CT show homogeneous enhancement, and in MR show non-specific sign like azodense to the gray matter, and KBs show CSF secreted. This is the classical appearance on the germinoma by the axial CT, show hyper-attenuated lesion in the center of the brain behind the fourth ventricle, engulfed central calcification. This is typical appearance of germinoma and causes hydrocephalus. Another example of patient by axial CT, there is hyper-attenuated mass posterior to the third ventricle, surrounded engulfed central calcification, where the contrast enhancement show homogeneous enhancement. The hyper-attenuated mass posterior to the fourth ventricle can be involved with thalamic region and pythalamic. In this case, is involved in thalamus. In the MR, show non-specific gray matter MR signal in the T1 weighted image, isoattenuate mass, and the T1 weighted image after gadolinium show homogeneous enhancement. The next most common type, which is teratoma, with sharply circumscribed mass, loculated and multicystic, heterogeneous tissue containing fluid, fat, soft tissue calcification, enhancement of the solid area. By the axial CT, there is a multicystic mass containing different attenuation level posterior to the third ventricle. This is a typical pictures of teratoma. Another example of teratoma containing fat by the axial plane CT show low attenuation fat in this area. By T1 weighted image, this fat show high signal intensity. This is the multilobulated mass with different attenuation level posterior to the third ventricle. This mass after gadolinium T1 weighted image show enhancement of solid area, which is the typical appearance of teratoma. Pineal gland teratoma may rupture either spontaneously of eye or following a trauma, so that the lipids content leak to the subarachnoid space and make fatty fluid level in chemical shape artifact. Pineal and suprasellar teratoma mixed type, like in these cases, there is a mass in sagittal T1 weighted image, there is a mass from isodense in the pineal region, and another mass in suprasellar cystic. This mass is not germinoma, not teratoma, is the mixed type of germ cell tumor. This is after enhancement, both of them show enhancement lesion. This is the classical appearance of teratoma, which is hyper-attenuated mass surrounded in the pineal calcification posterior. Patient came with their backache, and by the sagittal MRI of the spine showed the tumor less separated in the spinal cord. Pineal parenchymal tumor like Pineoblastoma and Pineocytoma and trilateral retinoblastoma. Pineoblastoma is highly malignant lesion with exploded calcification affected the lung patient first 2 decades. Pineocytoma is relatively benign, affected the lung or all patient and slow growing lesion. Pineocytoma, well demarcated, slow growing, usually less than 3 cm, ISO to hyper attenuating CT, on T1, ISO to hypo, on T2, hyper intensivated image, accounting for 14 to 16% of the pineal gland tumor. This is the case of pineocytoma, a well-circumscribed lesion, hyper attenuating mass on CT with excluded calcification. Calcification located peripheral, posterior to the third ventricle. This is another case of pineocytoma, which saw hypointense lesion in the pineal region, sagittal T1 weighted image, and in this area. In ADC, show hypercellular mass posterior to the third ventricle. Pineoblastoma, which is large, typically more than 3 cm, lobulated, hyper-attenuated mass. Nearly 100% of the patients have obstructive hydrocephalus, most aggressive tumor, and highest grade tumor among pineal parenchymal lesion. This is the hyperectomy mass on the axial CT, large, lobulated, posterior to the third ventricle, show excluded calcification located peripherally. And the MR is not specific to homogeneous isodense mass. The pineal cyst. Pineal cyst in asymptomatic cases affected 2 to 8% of the adult, diameter about 2 to 7 millimeters, which is common, and may be large, which is not rare, about 14 to 25 millimeters. May expand the gland. The most important thing, there is a ring enhancement, should be smooth and thin, only about 1 to 2 millimeters. This is the sagittal image for the patient have pineal cyst. Pineal cyst in this area show a thin rim, smooth enhancement, which is the typical appearance of pineal cyst. The differential diagnosis of pineal gland that are Astrocytoma. Astrocytoma arises from splenium of the corpus callosum, the thalamus or tectum of midbrain. The astrocytoma in this area arises from the splenium of the corpus callosum. They are different from pineal gland tumor as this mass located above the internal cerebral vein. So most of the tumor of pineal gland below the internal cerebral vein. Meningioma, another differential diagnosis, approach to the dura, false centurion, which is homogeneous and shows dural cell sign. This is the sagittal MRI for the patient. So this mass, which is ISO, and after contrast enhancement, show the typical appearance of dural cell sign. This mass located above the internal cerebral vein and causes compression in posterior fossa, causes sign and symptom the same as of pineal gland tumor by compressing cerebral aqueduct of salvius and cause hydrocephalus. Diagnosis like lipoma by the axial CT show this area which is have fat attenuation posterior to the foreventricle, and the sagittal MRI show the fat signal intensity region located below the line of the orientation tentorium between the straight sinus and anterior clinoid process. This is the case of lipoma, which is compression posterior fossa region and cerebral aqueduct salvius, and causes hydrocephalus as the pineal gland tumor. pineal region mass collectively. In this area, there is a hyper-attenuated mass surrounding central calcification, which is the germinoma, which is most common type. Teratoma, multicystic mass with different attenuation with fat content, which is teratoma, and pineocytoma, pineoblastoma. They are different from each other by the size. Pineocytoma small, pineoblastoma large, with excluded calcification. Both of them show excluded calcification. Lipoma show fat signal intensity on the sagittal MRI region. Pineoblastoma malformation show flow void region, and meningioma with dural tail sign. Thank you.
شكرا جزيلا دكتورة رائع عبد الكريم. عشتي يعني غطيتي الباينيال تيومر تقريبا كلية.